Ahead of the commemoration of the Day of the African Child on 16th June, a new report has shown that Uganda still has to do a lot more to make the country a safe place for raising children. The report by a child rights NGO Save the Children measured indices on the child safety like malnutrition, education, child labor, early marriage, adolescent births, displacement by conflicts, and violence.
There are signals for the disruption of their childhood, and these are: the child dies, the child is severely malnourished, the child or drops out of school, the child starts working, the child gets married.
Uganda was ranked 132 out of 172 countries. The data, compiled from reliable and reputable sources, indicates that under 5 mortality rate, child stunting, and also birth rate are still high in Uganda.
In Uganda, however, we still see that close to 40% of children are exposed to violence. And these statistics mainly come from statistics in schools, so corporal punishment. But we do know that there is a lot of violence happening both at home and in the communities.
The report titled End of Childhood indicates that for every 1,000 live births, 64 children die before their 5th birthday. The country director of Save the Children in Uganda says children have the right to learn, play, grow healthy, and be protected from all forms of abuses.
In addition to these general challenges, let us also face that many children live in disadvantaged communities in this country, where they have been bypassed by progress that has lifted up some of their peers.
The report that was released at the Save the Children offices in Muyenga, Kampala, also indicates that 25% of the teenagers aged between 15 and 19 have already born children. It was also found that a number of children in different parts of the country don't have access to basic education, let alone quality education.
Children who are enrolled in primary 1 do not all complete primary education. Only 59.9% of these children actually go up to P5, and only 30% of them finish P7 in the UPE setting.
The report also shows that children with disability are increasingly discriminated against.
Children with disability in Uganda comprise 13% of our children, which is 2.5 million children.
Save the Children called mass registration of children for better planning for service delivery.
We would like to call upon different stakeholders, starting with government. And in health, we would like to see that government improves access to quality health care for mothers and children by ensuring that these services are available in our facilities and ensuring that we have skilled providers who are able to offer these services.
Uganda currently hosts hundreds of South Sudanese refugee children. The study shows that many are not able to access learning materials.
Let's ensure that all these children have a chance to complete their childhood. And let's not forget that research shows that if we invest in health and education and the well-being of children, this significantly contributes to national development and progress.
The End of Childhood report is released annually, and the Save the Children country director calls for immediate government intervention to improve the lives of children.
Asking the government and the development partners to increase investments in education, in health and in child protection, ensuring that we reach every last child.
Norway topped the list for its good performance in child protection and safety, while Niger came last. In East Africa, Uganda comes third after Rwanda and Kenya. Ivan Chimchigozi, NTV.